Opening shot. Host standing in front of a whiteboard with the title, "The Impact of Spinal Cord Injuries," written on it. Host: welcome back to our channel, where we explore fascinating topics related to health and wellness. In today's episode, we'll be delving into the effects of spinal cord injuries and discussing the remarkable role of physiotherapy in providing effective remedies. So, let's dive right in. Transition to animated video explaining the structure and function of the spinal cord. Narrator, voiceover. Before we delve into the effects, let's understand the basics. The spinal cord is a vital component of our central nervous system, responsible for transmitting signals between the brain and the rest of the body. When the spinal cord gets injured, it can have profound effects on a person's mobility, sensation, and overall quality of life. Cut to the host in front of a green screen. Host: spinal cord injuries can occur due to various reasons, such as accidents, falls, or medical conditions. The severity of the injury determines the extent of the effects. Let's take a closer look at some of the common effects of spinal cord injuries. Visual transitions to a list of effects with brief explanations. Paralysis. Depending on the location and severity of the injury, paralysis can occur in different parts of the body. Tetraplegia, also known as quadriplegia, affects both the arms and legs, while paraplegia affects the lower limbs. Loss of sensation. Spinal cord injuries can lead to a loss of sensation and impaired ability to feel touch, temperature, and pain below the injury level. Spasticity. This is a condition characterized by involuntary muscle spasms, stiffness, and increased muscle tone. It can affect movement and make everyday tasks challenging. Bladder and bowel dysfunction. Spinal cord injuries can disrupt normal bladder and bowel function, leading to issues with control and requiring specialized management techniques. Transition to a physiotherapy clinic. Host: while spinal cord injuries can be life-changing, there is hope for recovery through physiotherapy. Now, let's explore some of the effective remedies that physiotherapy offers to individuals with spinal cord injuries. Cut to a physiotherapist working with a patient. Physiotherapist. One of the primary goals of physiotherapy is to improve functional independence and enhance the overall quality of life for individuals with spinal cord injuries. Here are a few key techniques we use. Range of motion exercises. These exercises aim to maintain and improve joint flexibility and prevent muscle stiffness. They include stretching, passive range of motion, and active assisted exercises. Strengthening exercises. Strengthening exercises focus on building muscle strength, particularly in the unaffected parts of the body. This helps compensate for the lost function and enables individuals to perform day-to-day activities. Balance and coordination training. Physiotherapists work on improving balance, coordination, and postural control to enhance stability and reduce the risk of falls. Assistive devices and mobility aids. We assess and provide assistive devices like wheelchairs, walkers, and braces to improve mobility and independence. Transition back to the host. Host: in addition to these techniques, physiotherapy also involves specialized interventions such as electrical stimulation, hydrotherapy, and virtual reality-based rehabilitation, which have shown promising results in spinal cord injury recovery. Closing shot. Host in front of the whiteboard. Host: spinal cord injuries can be devastating, but with the right approach and the help of skilled physiotherapists, individuals can achieve remarkable improvements in their